to limit their comments to 2 minutes. Any person interested in providing comment should email publicmeetings@rockyhillct.gov. You will be provided with the link to the Zoom and instructions how to participate. And I know we have several tonight. Before we get to public that wants to make comment, I have one comment to read in, which will be answered during the health district report and not right now. But the comment is from Krista Mariner. Krista Mariner, 58 Farms Village Road, Rocky Hill. I have a few questions for Charlie Brown of the Central Health District. First, what are the current counts for Rocky Hill, including fatalities? Second, the numbers have gone up steadily over the past month. What are the most significant contributing factors, such as small gatherings? Third, is that Central Health District going to have any pop-up testing in their member towns to meet the demand for increased testing? Fourth, what role will the Central Health District be playing in vaccine distribution? Do you anticipate having any vaccine distribution drive-through clinics when Connecticut enters phase 1B? Thank you for your help. And of course, these are all questions regarding the COVID situation. And I know Charlie Brown has a full report on that, so we will get those answers momentarily. But moving to public comment, I note that we have Mr. Bob Scotty on, who has spoken before public safety before in this medium. Bob, do you want to go forward with a comment or two, or? You're muted. Still muted. Bob, while you're working on that a little bit, maybe I can ask if Jillian Maynard is ready to make comment. Jillian also participated in one of these before. Welcome, Jillian.
Thank you. Thank you for giving me a couple minutes. Yes, I will probably sound like a broken record, but I am just here again to speak about the speeding in town. I live at 101 Bailey Road, and it's just been, to me, it seems like it's getting increasingly worse. I understand that I also am home all the time now, thanks to the pandemic, so I might be a bit more sensitive to it, but you know, being home all the time, I see the people at all hours who are just turning the corner onto Bailey and speeding down, also going down Parsonage. I walk with my son around town. I see it on the Silas Dean. I see people blowing through the stoplights. And in addition to that, I just wanted to raise that it seems like a lot of these cars have modified their exhausts and their engines, and they're driving up and down the streets late at night. And I don't even know if anything can really be done about this, but I'm just bringing it up because I do have a lot of concerns about, you know, having a small child and living on the street and all the people that I see walking every day. And it's gotten to the point where my husband and I over the past couple of months have seriously considered moving and had that conversation a few times, just because it seems like it's just getting worse week to week. So I just wanted to raise that. I love living in Rocky Hill. I don't really want to move. I don't think that's something we're actually going to do, but I am very concerned about this rate of speeding that's happening in town. So thank you for giving me a moment to share my piece, and happy holidays.
Happy holidays to you as well, and thank you. Sorry that it's persisting. Bob, Scotty, are you able to? Sorry, sir. While Bob is working on his mute button, maybe, Mayor, did you have anything to add? I know you're here. Welcome tonight. No? Okay.
Ed, you may want to suggest maybe Bob call in from a cell phone, the direct line.
I'm not sure what that direct line is. John, do you have it handy?
Let's see here. Yeah, Bob, if you could write this down, it's 312-626-6799. And I think it's going to ask for a passcode, which is 566390.
Don, can you repeat the number again? Maybe Bob needs it. One more. Go on.
The phone number again is 312-626-6799. And the passcode is 566390.
So you can, John, Counselor Emmanuel, he should be able to call that right now and be live.
Yeah. Yep.
Bob, are you ringing?
Is there anybody else in queue, Ed?
There is nobody else in queue after Bob.
Okay.
Go ahead, Bob.
He's probably going through the motions to do the passcode or something.
Try hitting *6 on your computer to see if you unmute, if that helps unmute. *6 on your computer.
On the phone.
*6 on the phone.
I think so. Yeah. All right.
There you are, Bob. You're showing up on the screen. Just mute. Oh, there you go. You're unmuted.
There you go.
Is the volume down on his computer for the microphone?
He's on the phone, so it shouldn't matter. Like, the phone.
Save Chromus, I can hear you. Can you hear me?
Bob, unfortunately, we'll have to move on. We know you called about car thefts in your circle, and certainly we can talk offline. But thank you. All right, thank you for trying. We appreciate it. So we will. We're going to move forward on the agenda now to department reports, starting with the fire department. Chief Garahy?
How about that? Can you hear me?
We can.
All right, thank you. I'll just go over the monthly report. And we responded to 49 incidents in November, brought our total up to 568. A little bit off from November 2019. Our training hours were 315. And out of that, we were able to record our last live burn in there. 0 injuries reported. Staffing remains about the same with 68 active, 73 members. We terminated 2 and we have 5 members on leave. With that said, we brought 3 new members online last month, and we currently have 7 prospective members in the application process, actually 5 of which from one family. And under health and safety, both our administrative and operational COVID directives have been updated. And we worked with KERMA to get a approved driver recertification program and training course. And all drivers will go through the evaluation process. We're about 2/3 of the way through it now to recertify in the month of December. A task force executive committee meeting was held. We agreed upon several changes to the policy by all 6 chief officers. These changes were then disseminated to all personnel. Lastly, about 40% of the department's self-contained breathing apparatus air tanks have been successfully hydro tested by a certified vendor. And we have plans and a schedule to test the remainder before June 30th, 2021. Couple other things real quick. We also, in regards to the task force, held a technical rescue committee meeting at Station 3, followed by, I believe it was last week, a technical rescue drill. So we're moving forward with that platform. And that is all I have.
Any questions for the chief? Counselor Emmanuel,
No questions, thanks.
Counselor Prakash.
No questions at this time. Thank you.
Chief, just one question on the incidents responded to, 49. How many of those, or what percentage of those are automobile fender benders, bang ups?
If you move a couple pages in the report, Ed, you can see manpower analysis by incident.
Yes.
And if you go down to 322, 324, you'll see those are motor vehicle accidents. And you'll see what's that, 12?
Yeah.
We went to 12, so about 24%.
Thank you. And one other question on calls when they go out, you're always going on a call, hell bent for safety, and I mean, there's no call that says, hey, this one might not be an important level call. I mean, you get a call, you got to go at it as if it's a blazing fire or a life and death scenario. You don't get to know that until the first person is on the scene.
A lot of that's called service calls, water in the basement.
So only if the
Covering up.
caller in gives you a description.
Right, and if you go into the unknown, fire alarm in a building, you treat it as just that. The building's telling you that something activated the fire alarm. So yes, we do have hot responses and cold responses. I'll tell you, the hot responses outnumber the amount of cold responses.
Thank you, sir.
Thank you.
Ambulance, Joe Gray.
Good evening, everybody. Excuse me. For the month of November, we had 386 calls. Year to date, 3,797 calls in town. We currently have 81 members. I lost one to school again. These kids all want to better themselves, going to PA school and becoming doctors and nurses. And I gained one, put another one online. And I have 2 more that have showed interest and are in the process with background checks and interviews. The
Joe, what was your total again for the year?
3,797 calls. The state had a medical supply, PPE supply drop off again. They sent us an email. We went up. They were extremely generous. We ended up receiving 1,600 surgical gowns and 18,000 surgical masks, the face masks, simple masks. So, excuse me, we added that to our supplies, and just in time. Looks like we're going to be needing them soon. Other than that, everybody is doing very well and healthy, and we're still plugging along.
Joe, you successfully pulled off your community event.
The Santa Claus Express went fantastic. The Parks Department was a huge help. The Highway Department helped us out, and we ended up having 263 cars go through, and 487 children met Santa Claus, and really made their year this year. We also had 5 sponsor families that we took care of, and got them a lot of needed stuff for themselves and their families for Christmas. So it was a huge success, and the townspeople jumped in and helped set up displays, and it went off really well. I got huge positive feedbacks from it. Couldn't be happier.
Thank you. Any questions, Councilor Emmanuel?
No questions. Just to tack on to that, Joe. Just a lot of kudos, your collaboration with the businesses and things like that. I had the family go through it. They were ecstatic. It was just an immense success. And I'm just thinking, the logistics probably were more challenging than you would normally go through every year visiting homes. I think you just raised the bar for following years. So kudos to the association and your collaboration with everybody else. Drew must have had his hands full with the logistics and everything. So I think it was well attended and well served. So just kudos.
Thank you very much. Great to hear it, and much appreciated. Yeah.
Emmanuel,
It's a logistical nightmare, but every year it's the same thing.
Drew must have been in heaven.
We all were. When you see the kids' faces when they see Santa Claus, and they just lose it and just are in complete awe. So it makes it worthwhile every year. So thank you, though. Greatly appreciate it.
questions, Councilor Prakash?
No questions, Ed, but I would just like to second Councilor Emmanuel's sentiment on this, and thank Joe on this.
Thank you very much.
Also seconding that, I did hear as well great things coming from the event, Joe, and the Health District would be proud to know about your procedure for appointments, lining cars up, communicating to everybody how it's going to go, and keeping them flowing one at a time and socially distanced.
Yes, we ran everything by Charles, and he was very pleased with the operation and everything, and it worked out well with everything. So, and thanks to him for approving it and making sure that we did everything possible to make it a safe event.
Y'all guys did above and beyond. It was really a well-run event, guys.
Thank you.
Charlie, were you there?
Nope, I actually saw it on the news, and with everything else that was going on, I think it was very well done, very well executed.
That being said, we are moving on to police. Chief Custer. Chief, I know you've had some comments coming in surrounding 60 West Street, so we're interested to hear your report on that. We appreciate it.
Okay. All right, well, let me go through the preliminary stuff here.
Sure.
First of all, just some statistics for the month of November. We received 3,003 calls for service through our dispatch center. We had 31 criminal arrests for the month, 34 motor vehicle accidents investigated, 21 motor vehicle infractions were issued, and an additional 62 warnings were issued as well. Our training hours for the month were 178. Terms of staffing, we are still presently 6 officers down. The good news is that I have 4 officers scheduled to start in the month of January, so that will help us immensely. And we're conducting 2 background investigations on the remaining 2 vacancies. If all goes well, I hope to get those people on board by the end of February. So hopefully by the end of February, all 6 of those vacancies will have been filled. I also have 1 officer who's still in the police academy as well. Happily, no officers are out on administrative leave or on COVID-related incidents, so we're good there. I just wanted to respond real quickly to Mrs. Maynard from 101 Bailey Road. We did go out. I'm not sure. I'm assuming you made contact with Lieutenant Phelps or someone from our agency, but we did go out onto your street from mid-March to mid-November. I have the data here. We conducted 20 traffic posts on the midnight shift during that 4-week period. A traffic post is basically when officers set up for about 30 minutes and monitor the street for violations. 0 violations during those 20 traffic posts on the midnight shift. On the day shift, we did another additional 18 traffic posts, and they did have 8 violations, which they addressed. And then I have another report here. On the evening shift, they did an additional 14 traffic posts with 4 violations observed and addressed. So it seems to be there is somewhat of a problem on the day shift. And of course, that's what you're seeing and experiencing. So if I could just ask you, if you haven't reached out to Joe Phelps, who's my lieutenant in patrol, and he doesn't have your phone number, if you could drop him an email, I'll let him know you're going to be sending an email. His address is J Phelps, J Phelps, PHELPS at rockyhillct.gov. And just give him a contact number, and then he can go over this data with you in more detail. I hope that was somewhat helpful for you, but we were out there. So
yeah, thank you. I appreciate that. Thanks.
You're most welcome.
Chief, before you jump in ahead, down 6 officers, 4 to start back in January. What would your patrol officer count be at that point in January total?
With those 6 officers on board?
Yep.
Well,
the 4 to start in January. You're down 6. You got 4 starting in January. What's your total?
That'll bring us to 36.
Thank you.
You're welcome. And then in regards to 60 West Street, John, I got your email. Emmanuel, do you want me to just go through that list, or how do you want to handle that?
Yeah, I mean, I did receive some questions, and Mike, I'm trying to remember back. This is 4.5 years ago when we were discussing some of these high-level security concerns, and the prior town manager pretty much requested that it be taken off monthly reports because there hasn't been much going on. Yeah. So it's been a challenge recollecting some of these discussions. So I'm not sure if, based on my questions, and if you've had recent conversations with the facility about their security rules and regulations and things like that, maybe you can update the public.
Okay. So real quickly, yes, we have been in contact with the staff at 60 West Street. We keep a dialogue going with them all the time. There was some public interest in 60 West Street recently because there's a new resident now staying there, that apparently has some notoriety out of the state of Massachusetts, and there may have been a news story or two on this individual coming into Rocky Hill. So, one of the questions we were asked is, have we been notified of this? And the answer is yes. We get notified every time there's a sex offender that comes into town or was in town and then leaves town. The other question that I got was, who does that go to? So I, as chief of police, get a notification. The town manager gets a copy of that notification. And if the address of where the individual is staying is in close proximity to a school, the superintendent of school gets notified as well. So in this case, all three of us did get notified. We have dialogue with the facility, like I said, and there's no special alerts or concerns with this individual above and beyond what they normally have there. I will just note this individual is not under DOC or state protection or not protection, but care or responsibility. The individual is just a regular patient there. So one of the questions was, is everyone housed at 60 West Street under the Department of Correction Control? The answer is no. There's actually two sections, one for the state DOC patients, and then the other side of the building is for regular, normal nursing home patients, of which this individual is. So we have to be respectful of their private rights as well. But John, in terms of activity, there's virtually been none. No criminal arrests have been made at that facility the first 11 months of this year, nor all of the last 2019. So the bulk of the calls up there tend to be medical calls and some fire calls. I pulled the data for this year. There's only been a total of 57 calls at 60 West Street. All of 2019, 60 calls. Compare that with some of our other facilities. Elizabeth Court, 274 calls for the year so far.
And Mike, are those,
Chief, 57 calls for the year?
So far, yes, at 60 West Street.
Thank you.
Mike, are those police calls or ambulance calls?
All they're all police, fire, or ambulance.
Okay.
So generally 90% of those calls will be ambulance or fire related. Types of calls we get are generally traffic complaints, parking complaints, and sometimes issues between the patients. If there's if they had a breach of peace, they have to document those. So we go out there and we just do a report. So that's basically what we're dealing with up there. Very, very little activity from a police standpoint.
Is there any difference with an individual like this that recently was accepted there and is not under custody? And is he or she free to go as he or she pleases?
Well, obviously, if they're not under the Department of Correction Control, they would be free to leave. I'm sure they have their own policies over there on that. But in terms of this one individual, I could share with you that he's not ambulatory. He's a sick individual, and he's not able to move on his own. So I just put that out there to maybe quell some concerns citizens might have that he could get out and and be a threat to the community. That's not likely with this individual with the medical condition he's in.
Okay. And the other question I had, and again, we're testing memories here. From our conversations years ago, they were reassuring us about their security measures. They had a security, and this is for the other side of the facility. Have you noticed any decrease or any changes in that level of security for those individuals? Do they still have security there?
Yes, they do have private security there. I have not noticed, or I'm not aware of any changes. Again, really, our point of contact from my agency would be Lieutenant Phelps. We had a conversation about this today. He's been in contact with them. He's not aware of anything. So there is security there.
Okay.
And there has been since day one.
Great. Okay. Thanks so much, Mike. Appreciate it.
You're welcome.
Any questions, Councilor Prakash?
So Mike, just listening to you, seems like business as usual from a police standpoint there, and most of the from a historical perspective, like last couple of years, and you don't seem to have a lot of concern vis-a-vis this individual coming into town, you know, and being mobile as such, and you know, so that's what I got from it, and I just wanted to make sure that from, like you said, like a lot of our fellow citizens are concerned about this issue, and I just wanted to make sure that we have a good understanding of what the framework here is for that facility to be in town, right? We don't control, or you don't control as the chief of police here, right? You know, his movements, the facility does, right? I mean, I just want to make sure that I understand correctly. The one part of the facility is the correction side of the facility, which obviously the part of the correction has you know, discussion over that and jurisdiction over that. But then the other side is more of, you know, a regular facility where there is a not, yeah. Go ahead.
You're absolutely right. And, you know, in terms of the Department of Correction patients, we don't have input in terms of who is placed there and who is not. That obviously is a DOC and state of Connecticut decision, but I can tell you they have a very strict protocol in terms of who is eligible to go there. And most of the time the patients who do get sent there are terminal. So, you know, in terms of risk to the public, it's extremely, extremely low.
Thank you, Chief.
Ed, do you hear me now?
Oh, this is Bob Scotty from the
Yes.
public.
Thank you.
Very good.
Fine.
We see you and we hear you, and we'll let you speak in a minute. We're gonna proceed. We're gonna kind of bring the chief, let the chief finish his report, and any questions there. But great, I'm glad you persisted.
Yes.
I don't know if the mayor has any questions of the police chief at this time.
Yeah, if I may, Chief, I know that residents get concerned about, I guess what we call residency restrictions. And so legally, are there any restrictions with respect to this particular offender or those who are convicted of these types of crimes from living within a certain proximity of a school?
No, there are no restrictions that I am aware of. The only caveat to that is, again, if their address is within a certain perimeter or distance from a public school, then the superintendent will be notified. And as I mentioned, in this case, that was done.
Okay, thank you, Chief.
You're welcome.
I'd like to add, with Counselor John Emanuel, we were both there during the probably last official council discussion on this topic. We had to consider the legal challenges that the town had, and I don't know if you want to say anything about it, but I know the town spent considerable money on pursuing appeals and legal challenges that eventually did fail on us, but we weren't able to stop this way back when. Is that how you recall it? I mean, that's what I remember from some of our meetings in chats with legal counsel. Much of what we can't go into because it was executive session, but I assure folks that the town pursued legal avenues at the time.
Right, you're correct. Without going in, yeah, you're correct. Without going into details, you know, the town did pursue everything from beginning 5 years ago. 6 years ago. And you know, we are where we are, and as the police chief has notified us, I mean, there hasn't been any criminal areas that are concerning, and this person in particular is not ambulatory. if anything changes, I would hope that this committee and the council would be notified.
So the other point that I would like to make for the general public listening in is that, yes, the dots are connected. So the point that the chief did bring out, that the chief gets notified. Well, first, that he's in regular contact with the facility. 2, he is notified, the town manager is notified, and if a school proximity issue is there, the superintendent is notified. So we have 3 executive level officers being notified in their respective duties. So we do get the notification from the state and from the facility. So we do have that going on, and so that should help folks understand that this place just doesn't do what it wants to without notifications. Chief, any other parts of your report you want to continue with?
No, I think that covers it for me. I have nothing further to add. Thank you.
Thank you. We now have up emergency management. James Bellinger.
Actually, Ed, did you want to ask? Bob?
Before we move on to emergency management, good catch there, John. Public comment from Bob Scotty. Go ahead, Bob.
Hi, Ed, Chief Custer, Mayor Murata. This is Bob Scotty. I live at 59 Jennifer's Way. Back in September, I was on this call to talk to you about the problem we were having in our neighborhood. We're a 55 and over community, and there's a lot of elderly people here, single people, ladies included, more of those. We had a rash of people coming in, kids, several cars. We videotaped it, and you got a copy of that back a few months ago. The one house that they were after was a white Audi, and that's been parked in the garage since summertime. But the only reason that we found out that there was activity here was because of one of the Ring doorbells that they put up for their family for an Alzheimer's patient. But I noticed that Chief Custer, you have put, I think, 2 or 3 times a day, your officers have been going through here. We haven't seen any extra activities. I talked to my neighbor who has the Ring doorbells. It's been pretty quiet since she has 2 old cars that are sitting outside rather than the nice brand new one. We don't know if anybody has been through here, but there's been no damage. So that's a good thing. I think maybe you can tell me, is it 2 or 3 times a day you come through here at different, all 3 shifts?
Yes, that's correct. And you're probably not even aware of the midnight shift because you're probably in bed, but
right.
You're very active all night as well.
Yep, I've seen them throughout the day, you know, sometimes early in the day, sometimes at dinner time, which is great. You know, reading in the paper a few weeks ago that, you know, some of the towns have had a ton of break-ins, not only just getting, you know, the car opened, but breaking the glass. You know, we're like sitting ducks. And that's how most of my neighbors feel. And to make light of it, I was watching with my 3 granddaughters the other day, Home Alone, and I'm saying, you know, what could we do, you know, for these guys? You know, I've taken your word saying, you know, don't, and I've told my neighbors, don't go out, don't do anything, just call you guys. And that's all we can do. So again, I appreciate, you know, you guys coming through here a few times. Like I said, it's been quiet. And I talked to a lot of the people. So, you know, a lot of the ladies are a little scared. But I've told them, you know, when you pull in the garage, shut the door, make sure, you know, you're in and you're safe. So again, thank you. I did talk to our state rep, Miss Woods, and she said it's a problem. How do we get this to get changed where your officers can stop these kids and arrest them? I guess she's going to take that up to Hartford, and things like that. Has there been an update? I know you said you can't park a car, you can't chase them. What's the latest update, Chief, that you can tell us and I can pass on?
Okay. Mary, you want to chime in or you want me to answer this?
So, Mr. Scotty, there hasn't been a heck of a lot that's changed, unfortunately. And it really will be up to lawmakers to decide what they're going to do come January. So we have certainly a number of surrounding towns, number of chiefs in surrounding towns have reached out to lawmakers. In fact, we have them coming at our 7 o'clock council meeting. I would encourage you to chime in, public comment on that one, because it is important that we take a look at some of the tools that we could give our police officers and our courts that would enable them to address some of these concerns. Actually, this one concern, because we do see that juvenile crime is starting to go down, right? But when it comes to property crime and the car break-ins and the stolen vehicles, those are going up, and the propensity for violence associated with those crimes is going up as well. And so we've heard from law enforcement, we've heard from prosecutors, just on a webinar I was on yesterday with state lawmakers and a bunch of different social service advocates, and the prosecutors and the law enforcement officers are basically looking for consequences, some type of diversionary program, something that we can put these kids in to just let them know, hey, there are consequences to some of these actions, right? And that's kind of what we need. And until we have those tools in our toolbox, it's a little bit difficult to see these numbers go down, but we are trying, we are advocating super hard, and hopefully we'll see some new policies put in place.
Is there anything, our neighbors can do besides calling, the state reps, state senators, which I've been asking them to do? Is there anything more?
I think the more you email them and make phone calls and keep on top of it, that's super helpful. And certainly anytime we hear something, when this particular matter comes up, we'll shoot out some information on that so people can, be right on top of it.
That'll be great. Now, would you like me to sign in for the 7 o'clock meeting also, Ed? Is that what you said?
You are welcome to that. John Murphy asked me which one you'd like to speak at, and I told him that you had spoken at public safety before.
Right.
So you probably you wanted to speak at public safety. But given that there's a potential for us to have our state legislators there, you are more than welcome, sir, to call in, follow this procedure for the next meeting. And John Murphy's probably listening. Actually, town manager's on the call right now, so we can help you get in. But,
okay.
You are more than welcome to make comment again.
Okay.
It'll probably be less interactive than this, though, at the council meeting. It'll be more comment and go. Okay.
All right. Thank you, everybody. Thank you.
Thank you.
Thank you, Mr. Scotty.
Okay, Mayor. Okay.
Yes, Councilor Prakash.
No, I was just thanking Mr. Scotty for his input.
Got it. Chief, on the motor vehicle thefts, I'm looking at your chart. They kind of go up and down, but it seems like when we're down, the next town over is up. I mean, there's waves, right? Is that what we're seeing?
Yeah, that's exactly what it is. They seem to be moving around. So for November, our numbers were down, and we only had 2 stolen motor vehicles in town for the whole month. And our thefts from motor vehicles were down to 22, which are both lower than the prior months. So, I mean, 22 is still too many, but we're seeing these fluctuations as they seem to move from town to town. And, we're down. Ironically, Newington got slammed. And I read that Meriden got slammed 2 nights after that. So I think you're spot on. That's exactly what's happening.
Yeah, whether it's Rocky Hill, the state rep district, or the senatorial district with the 5 towns, we see a roving wave that happens, unfortunately, and doesn't seem to be letting up much. So, okay, enough on that. Thank you very much for your report and your time tonight. Emergency Management, James Bellinger.
Good evening. How are you? Currently, I am working with the state vendor for the emergency notification platform through CT Alerts. I'm hoping to have all that information uploaded and active as of March. The Veterans Home, I guess they have low staff for doctors and nurses, so they requested the assistance of the Capital Region Medical Reserve Corps. And by state statute and emergency management statute, had to get signed off by Rock Hill Emergency Management, the Health District, CROG, and then it gets signed off by State Department of Emergency Management and Homeland Security. So they should be filling in there. They supply doctors and nurses to assist in their staffing level. Last week with the snowstorm, emergency management facilitated the coordination of services, and we had the EOC open from Wednesday night into Thursday afternoon. Overall, it was uneventful. There was low calls for service, and that summary report was released today to everybody. The COVID EOC meetings are now meeting weekly. And with that, with the uptick, we're going to continue doing that weekly. The COVID testing that we were looking to do has been approved, and we're just waiting for a date. And that's being done through Rich Renstrom, so we're just waiting for a date for that to be held. And then we are also going to be supporting the Central Connecticut Health District when they do their vaccination. So whatever services we can provide for them, we're going to assist. And that's all I really have.
Councilor Emmanuel, any questions?
No questions, thanks.
Councilor Prakash.
No questions at this point. Thank you.
James, that's great news on the testing center and helping out with the vaccines. We'll be hearing from CCHD in a moment. And I just want folks that are watching from the residents to know that there's going to be a pop-up testing and that there will be vaccinations made within the district in Rocky Hill, which is great news. So we're happy to announce that. And Charlie, I didn't mean to steal your thunder there, but you'll outline that for us, and we're very appreciative of the team that put that into play. I did get your snow alert, your incident report. Thank you for those. And again, just to draw attention to emergency management, this is rather new this year, and we're getting these reports from you, and you're tying us all together. So this is very much appreciated, your efforts in this area for the town. So with that being said, we will move on to old business and an update from the Central Health District. Charlie Brown.
Thank you. Currently, the counts for Rocky Hill as of 12/20. The number of total confirmed cases in Rocky Hill stands at 950, so just below 1,000 members. Unfortunately, we've also had 101 fatalities since the pandemic has started. The numbers really have, we've seen a lot of the numbers go up here over the last month or so, about 6 weeks. A lot of that is from Thanksgiving and the small family gatherings that we've seen. That's been the biggest contributor at this time for the surge. And, we're expecting that to be worse if people can't really limit their gatherings coming into the holiday season with Christmas. That, and we're also seeing a younger cohort of patients at this point. And the younger folks, they don't tend to, succumb to the disease and die as often as some of the folks that are a little older, but they do have a tendency to spread it much more widely because they may not feel well, they may not feel sick at the time, and will continue with social gatherings and things of that nature and work and everything else. So they do tend to spread the disease a little more widely. Um, Thanks to James and Rich for the work in the pop-up testing. That's going to happen here really soon, and we're happy to make the connection with the state contractor to the town. I know you guys are working very hard to work out the details for that so that can happen here very soon. As far as vaccination is concerned, we are going to be involved in the vaccine distribution, but how we do so is really going to be affected by a lot of factors. Currently, we're trying to work through learning the vaccine administration management system that's going to be part of the process. At the beginning of this process, CDC is being and the state is being very cautious and wanting to make sure that every single dose is going in the right direction, right into the arms of the first responders and healthcare workers. So we're learning that system. We're probably going to be ready to start vaccinating here right after the turn of the year. We're very encouraged that some of the first responders and frontline medical workers have already started to be vaccinated. So that's encouraging news, and we recognize that folks are stepping up in that way. We are looking at a variety of options once we get vaccine in our hands on how we're going to distribute it. It's probably not going to be drive-through vaccinations at the beginning of the process or anything that looks like our normal flu clinics at the beginning of the process, just because we're not anticipating getting the volume of vaccine that we normally get. So, we're probably going to be doing much smaller, more appointment-based clinics or mobile clinics where we actually reach out to individual groups that meet the criteria for vaccination at that point. The state has put out some additional information on phase 1B, which is going to be a broader expanse of first responders, educators, and in addition to that, those of 75 and above. So we will be looking very closely and preparing for vaccinating that group. That just came out today. So we still have to kind of get our plans in place to be able to address those. And it's not going to be, I think, opened up broadly once they do 1B. I think they're going to still prioritize it within that grouping as to who we're going to reach out to. But we're happy to be able to work with each one of our towns in Rocky Hill to provide the clinics and provide the vaccine once we get it. Probably, like I said, maybe about 3 weeks out from the point, I think, to where we're ready to actually start vaccinating. And with that, I'll stand ready to answer any questions.
Councilor Emmanuel?
I don't have any questions. Ed, you got questions from Krista, correct?
I think I
Charlie
covered it.
Charlie hit all four of those questions.
Okay, great. Yeah, I don't have any questions.
And the two that were embedded within. So,
Great. Thank you.
Councilor Prakash.
Yeah, Charlie, thank you for that wonderful report. It looks very positive. Obviously, we are all anticipating getting those vaccines into the system and being widely distributed. But before we have that wide distribution, obviously, I would like you to address some concerns which I have is we tend to get our guard down when we do something like this. And I just want to make sure that we reiterate our commitment as a community to wearing masks and social distancing and everything else, which we need to do before these vaccines are widely available.
Oh, absolutely. And you took the words right out of my mouth, sir. We do absolutely still need to do the things that have kept us as safe as we've been over the last 9-10 months. And that's the 3 W's. So wearing a mask, washing our hands, and watching our distance. Now that we have a vaccine, we have the possibility as we roll this out to be able to protect those people who are most at risk, but it is going to take time. And during that time, we do need to continue to do the things that kept all of our communities healthy. So we can't let our guard down at all. So So I thank you for bringing that up. It is a very important factor as we move forward through the vaccinations and hopefully, towards a little bit more normalcy as we head out of 2021.
And one last question, Charlie. This is more on on a practical level for all the elderly citizens. What will be the process? Do they have to go through you guys or their medical providers to get in that line? Like
right now, I mean, the process is still being determined. They're using a vaccine administration management system to be able to actually manage what's going on at the very early stages. When they do open it up to more of the general public, we're not certain if they're going to continue using that system or if they're going to transition to something a little bit broader to allow us to be able to do things a little quicker. To be honest, the system that they've got really is a little restrictive. It is very time intensive. And where normally we do vaccinations like in 2 minutes time frame from front to back, we're looking at closer to 20 minutes or more per person now because of the needs to do a lot more education because this is an emergency use authorization for these vaccines. There's a lot of risk communication that we have to do for each one of the people that actually receives the vaccine so that they can make an informed choice. So, it does add to the time that it takes to actually get the vaccine. A lot of this information, as I said, is going to be put out as we get a little closer to getting the general public and getting those folks ready for this. And we'll be able to have that information to the towns at that point.
Thanks, Charlie, and thanks for all the work you have been doing. Really appreciate it.
It's our pleasure, our honor.
John Mayer, any comments, questions? We're moving to new business, but I didn't know if you wanted to. John?
I had to unmute myself and I had to find myself on this prestigious list of people tonight. Mute myself.
Doctor.
Quite a bit has been covered tonight, and I don't really have much to add to that, and I have no additional new business.
Any other business?
No other business.
No other business. I'd like to say, Chief Garrahy, are you getting younger? Got that haircut, man. What are you, 51? No, don't answer that.
Yeah, thank you.
Yeah. In any event, do I have a motion to adjourn?
Motion to adjourn.
Second?
Second.
Good night, everyone.
Take care.
Right.
Happy holidays, y'all.
Happy holidays. Nice.